The best conference I've ever attended for the last 25 years.
It's contributed to the physician that I am today.
It's become a much bigger event than just the CME itself.
It has improved not just in quality, but in stature as well. We started out what was then Omni, I think. Then we went to the Westward Look and had many, many good years there.
They treated us very well, to the point of even expanding their capabilities in their conference room to allow us to continue to grow.
We outgrew it. And I think as the conference has grown, it's just simply had to go to other places.
I've enjoyed the meeting when it's at La Paloma, and I think it's more centrally located. It's in a beautiful setting with views of the Santa Catalina Mountains to the north, and then overlooking the city of Tucson to the south.
Of all of the places the conference has been, my favorite was Marriott Star Pass. And I think because of just the, again, the level of activity that we were able to do there, and it was just a fun place to be.
It's been a lot of fun to watch the conference grow over the years.
It's completely different experience than when I first saw it in 1991 or 92.
It has grown and matured, as most of us have, both with our gray hairs as well as with our knowledge base, hopefully. The first year we held the conference in 1991, there were 25 attendees. And they basically were Tucson docs and some folks from Phoenix.
And you could go around and shake hands with every attendee and be sure that they were enjoying it.
And now we're 400 plus from 27 different states all over the country.
Since 2010, since I came on, we've jumped from just under 300 total participants to over 400 last year, and we're expecting to meet that number again this year, and that is really exciting.
That increase in registration has obviously resulted in a lot of other changes. It's given us a bigger budget, which has allowed us to develop a better and more comprehensive product as we've gone along.
Medicine has changed dramatically in 25 years. So if you're looking at the content and the breadth of what's presented, that's changed dramatically.
The biggest change in the conference over the last 25 years has been the technology in medicine, the electronic health record, and how to adapt to these changes and how to use them as tools. And I always feel like we have updates on that where it's important.
I think we did a couple of things early on that were a little bit unique in CME. One is that we had dual accreditation from both AMA and the AOA.
The conference was first co-sponsored with the University of Arizona College of Medicine, and it was an excellent sponsor. Just an excellent tie-in for the foundation.
Which, when we started out, was fairly unusual. In fact, I think it might have been exceedingly rare. I think it's still pretty unusual. There are not that many conferences where you can get Category 1 or Category 1A credit in one conference.
We're one of the few osteopathic accredited organizations in the nation to offer a dually accredited conference through the partnership with the Cleveland Clinic.
And in the process of that evolution, it's brought, I think, great educational events to the medical community, both the DO and the MD community in Tucson. We've gotten some great speakers to come in.
There have really been some not only knowledgeable speakers, but entertaining speakers.
As a layman, I originally dreaded sitting through 9 hours of lectures. They turn out to be fantastic. The speakers are so engaging and so much fun that I get a lot out of the lectures.
We are actually really excited to have Janice Knable, DO, back from the 1992 conference. She'll be presenting Dementia Then and Now. It's fun to see how much she has changed and how far medicine has come.
In terms of the spirit of the conference and the speakers and the focus, we really haven't changed. We are the Southwest Conference on Medicine. That's what we do.
We have been remarkably blessed with very high quality members of the committee.
The planning committee has grown over the past 25 years as well. In 1991, there were 3 members on the planning committee.
It's a dedicated group of individuals who truly take the task of providing quality CME very seriously.
It surprises me that several health professionals will come together once a month, take time out of their day.
They help us identify topics and faculty that are going to fulfill gaps in medical professionals' current knowledge.
They come, they consider the topics that need to be discussed as an ongoing review of what's important to primary care providers.
There's a lot of interaction on the committee. Sometimes sparks fly.
They are going to conferences and they are seeing who is offering the most up-to-date information across the country.
And we've had a lot of great presenters over the years from all over the country, and some internationally known speakers, and a lot of great academically based physicians who come in and give us the latest and the greatest and can bring real-world messages. Even when they come in with research data, the emphasis is on how do I take it back to the patient.
The end result is a conference that has star quality as well as a high level of medical content.